So I'm happy to present some of the work that we did. My topic is not to really focus on the metabolism, but so it's about the occult HBV infection. So, okay, next slide, please. Next, please. So the title, okay. So in 2019, okay, the TOR-MENA workshop on occult HBV infection faculty member updates the statements on biology and the clinical impact of occult HBV infection. So it was defined as HBsAg seronegative, but has the HBV cccDNA in the liver and or HBV in the blood. So OBI can be occurred with the infection of the virus has the mutation at S gene, or so in the promoter of the S gene, such in the PreS1 area or PreS2 area. The splice variant can also cause the OBI. So next, please. So currently, HBV vaccination has covered more than 90% in China. So the HBV vaccination reduce the HBsAg prevalence and reduce the SCC cases. However, so we can see here, when the vaccinated people get aged, so the case of SCC was observed. Next, please. So we conducted a hepatitis B intervention study in Qidong of China. Around 40,000 neonates received the vaccination after birth right away. And in the control arm, the neonates did not receive the neonatal vaccination, but they received the catch-up vaccination after 10 years old later. So we can see that S antigen prevalence keep the similar. However, some people receive the vaccination has increased the prevalence of the S antigen negative but anti-HBC positivity. So the HBV was detectable in their peripheral blood. So we sequenced the HBV from the vaccinated people and compared with the HBV isolated from HBsAg positive patients. We did not see much of the S gene mutation. However, there is an extensive mutation in the PreS1 and the PreS2, but no hotspot or specified mutation in the PreS1 and the PreS2. Next, please. It has been confirmed that OBI increase SCC risk. So to understand how and why OBI develop SCC would be helpful for SC control in the OBI people after they receive the HBV vaccination. Next, please. So to address the question, so we begin to we choose a ACC patient that were HBsAg negative, but anti-HBC positive. So we detect the HBV cccDNA in the neoplastic normal liver tissue. And the HBV rcDNA, the infectious HBV, was detectable in their peripheral blood. So next, please. We sequenced the PreS S gene of the HBV that isolated from HBV negative HCC patient. Still, extensive mutation in the PreS and S gene. No hotspot and no specified site gene mutation was observed. We then analyzed why. So we found that the amino acid of the HBV in the envelope protein altered in the amino acid properties. That means from the hydrophilic to hydrophobic, from acidic to basic to nature, or vice versa. So interesting, when we dig out the data from the sequence in the HBV hepatitis adults, is also have the similar pattern as we observed in the HCC patients. Next, please. We then choose one of the representative of PreS1 or PreS2 as a representative of the mutation, and also using the reference as the control. Okay, first return back, please. Return the previous slide, please. Okay, the 3D, the conformation, the 3D structure prediction found. So the conformation of the envelope protein altered compared with the HBV isolated from HBsAg positive patient. So we generated the replicating HBV plasmid and transfected the hepatocyte. So the HBsAg secretion from the site decreased in the PreS mutant, and the HBsAg was retained in hepatocyte ER organelle. Next, please. We already knew that hepatocyte ER is the promise site for the synthesis of lipids, carbohydrates, and for the folding, assembly, modification, and the transport of saturated or interpreted membrane protein. And the hepatocyte play a central role in metabolism. So due to the retention of the ER of the HBsAg, we then analyze 3 classical pathways that restore the cellular protein homeostasis under ER stress condition. So interesting. So the RER-HBB pathway was found mainly respond to the HBsAg retention in the ER. And this pathway is the key in lipid metabolism homeostasis. So we then quantified the sphingolipids, different type. So ceramides was found increased most greatly in the cells with PreS mutants, Among different type of the ceramides, the long-chain fatty acid ceramide, particular the ceramide with 16 carbons, increase most significantly. Next, please. So we have the slide overloaded with free fatty acid. So the total amount of ceramide increased, elevated significantly the hepatocyte HBV, and the dihydroceramide synthesize 1, ceramide synthesize 2 and 6 increased. When we use merimocin that inhibit the ceramide de novo generation, the total amount of ceramides and specified long-chain fatty acid reduced, however, did not return the level as normal hepatocyte did. Next, please. As we know, in the liver, macrophage consistently receive the signals from the hepatocyte. And the ceramide has been confirmed is the endogenous DAMP molecule to activate the NEP3 inflammation in metabolism disorders. So we then tested the macrophage activation for mediated liver inflammation. Notably, so ceramide together with HBV protein synergistically activate the macrophage NEP3 activation to secrete a significant more amount of IL-1 beta and IL-18. Ceramide alone or HBV antigen alone has less effect. Next, please. So for further confirmation, next, please, we treated the hepatocyte with the free fatty acid and use the conditioned medium to treat the macrophage. Definitely, for sure, we observed the macrophage inflammation was significantly activated and generated more amount of IL-1 beta and IL-18. When the hepatocyte infected with HBV, particularly with the SBS, with the PreS mutants. Please. Next, please. So to answer whether it's really true in the animal or in the human, as to mimic the human HCC development. So we inject the mice with 3 different HBV plasmid and give them different diet, normal cholesterol diet or high-fat diet. So in some mice, we inject the DAN to induce the HCC development. Next, please. So in these mice, we clearly see that if no DAN injection and no even have HBV infection, has HBV, so no liver cancer was observed. So that's has a HBV infection for 8 weeks and high-fat diet for 6 weeks. When the mice receive the high-fat diet, so we can see all the mice have the liver cancer. So the tumor size was greater in the mice received the PreS variant. When the mice received the Maralsan to inhibit the ceramide generation, still the liver cancer did not observe in the mice. Interesting, we observed that mice infected with the HBV has a higher weight of the liver, and the fatty liver was also observed in the mice with HBV, even they have received the normal child diet. Next, please. Next slide, please. So we collect the mice liver and examined the ceramide generation. So here we saw that ceramides increased significantly in the mice received the high fight, and even the mice have the HBV, they also generate significant more ceramides, and they have the increase the expression of the ceramide synthesize 2 and the synthesize 6. Next, please. So in the liver, so we can detect more amount of I1 beta and IL-18, and the mice has significant more inhibitory or inflammatory macrophage infiltration. And when we purify the macrophage from the liver, we can see that the NAP3 was activated. Next, please. So, of course, when the HBV, when the mice was injected with HBV and extending a long time, so for about 22 weeks, even the normal mice can also develop SCC. So that means so the HBV can, even with the normal child diet, can still develop SCC. So whether the macrophage is really critical or hepatocyte enough. So we block the NAP3 of the inflammatory macrophage by adopt the transfer the mice with the NAP3 bone marrow cells. So we see that. So when the mice was given the high fat diet and received the NAP3 knockout bone marrow, they have the less SCC liver cancer load. However, they did not change a lot in the normal child diet. Okay, next, please. So from this work, we would like to summarize that HBV PreS mutation that can alter the amino acid protease of the envelope protein that can inhibit SBSAG secretion. So when the hepatocyte infected with the PreS variant can generate abnormal ceramide, and the ceramide together with HBV protein co-activated the NAP3 inflammation in the liver macrophage, and that's promoted the inflammation to promote the SCC development. Okay, next, please. So because this is only in the animal or in vitro study, it's real in the real world. So in 2002, a work published. So that was followed for 11 years in the people with NAFLD in the company employee in China. So their work reported that the NAFLD, the people with NAFLD, really mainly developed with diabetes, hypertension, and hyperuremia, and no patient with NAFLD progress with the liver cancer. So, but only one male patient developed cirrhosis. Next, please. So now NAFLD the prevalence is quite higher. But whether it's really a major risk in the area of the people such as in China, so HBV infection maybe remain the major risk factor of SCC. So now HBsAg positive people was recommended with a healthy dietary or special care on the dietary. So however, the people with the HBV, with the vaccinated the people with after HBV vaccination and have the OBI infection did not pay attention to the diet pattern. So the high-fat diet pattern should be avoided for the people with OBI after HBV infection. Next, please. So this is the work. The work was as published in BMC Medicine. So the two young lady, Chang Liu and Qin Chen, did the work mainly. Okay, thank you for your attention. Here's my presentation.